By request of the meeting organizer, this meeting is being recorded.
Of Technical Assistance and Dissemination at the National Quality Center, and welcome to our March Partners in Care Roundtable entitled African American and Latina Women's Health Consumers. We're really excited to bring this program to you today, and we have a lot of speakers on today's agenda. So I want to make sure that we can go ahead and get started and spend a lot of time talking today. We have a relatively small group on the line, but in order to make sure that we can spend as much time talking about women's health issues, I think that we could still go ahead and enter our information in the chat room. As a small group, then it'll be easy to see where people are calling from and maybe help you identify some folks that you'd want to reach out to in the future to collaborate or to bounce some more ideas and questions off of. So in the chat room, if you could write a little bit of information about yourself, that would be really great. I'll start off. Michael Hager, NQC, New York, and Disparities Leader. Great. So if we could just go ahead and enter that in the chat room and try to set it to everybody so that your messages are coming to everybody and not just me. That way when we're talking in the chat room, it'll be easier to bounce ideas off of each other and to grow the discussion. And while we have folks entering a little bit about themselves in the chat room, I'll provide some ground rules. We really want you to use that chat room to interact with each other. Or as a small group, you can go ahead and just shout out your questions as well. And if there's time, the speaker will answer them. If not, maybe we'll wait until the end of the speaker's presentation to address it then. At that time, we'll also pull comments out of the chat room to make sure that we can bring conversations live that have been occurring behind the scenes. As a small group, I've not put everyone on mute yet, but I can if there's going to be unwanted distractions by background noise wherever we're sitting around the country, or if we put us on hold. If you put us on hold, we might hear your groovy on hold music. So we do advise that you use the mute function on your phone, or you use the little orange button to the right of your name in the webinar window to control muting and avoid putting us on hold. If you do put us on a hold and there's some on-hold music, I'm going to go ahead and mute you. And when you come back, if you want to speak, you can unmute yourself. We ask that you complete an evaluation that I'll be emailing to you after today's call. And just a reminder, in case you missed it, today's call is recorded and is going to live on the enddisparities.org website along with all of our other recordings. If you're curious and want to access those recordings, go to enddisparities.org, click on that review tab right on the home page, and it'll take you to the full list of webinars that we've had to date. Normally, our director, Clement Steinbach, would be providing a welcome to you all, but he's on vacation, the lucky devil. So I'll go ahead and take that responsibility on myself. And on behalf of the National Quality Center, we're really excited to have you with us today for this discussion. African American and Latina women is a very large group that involves a very diverse array of women and different issues and concerns, not only based on other distinctions within the group of women, but depending on where we are around the country and whether we live in an urban or a rural center and many other concerns too. So we're really excited to have you on the line today to discuss what issues are important to the women that you serve or the women within your community if you're a consumer like me. We're really excited to see where we can take this conversation today and how we build up into something even bigger as part of our overall End Disparities Learning Exchange outcomes. So on behalf of Clement Steinbach, Director of the National Quality Center, welcome to today's webinar, and we're excited to have you with us. For those of you who may know a little less about this exchange and it's your first time joining us or your first time listening in to a recording, the End Disparities Learning Exchange is a 9-month voluntary initiative that involves all Ryan-White HIV/AIDS funded providers around the country, recipients and subrecipients alike. And consumers are invited to join the conversation too. What we're trying to do is put together a community of learners that involve all of us on the phone today and beyond to engage in a conversation with each other about what works and what's promising to work, looking down the pike into the future in terms of ways that we can achieve health equity for the people that we serve at our clinics. The National Quality Center is a program funded by the HIV/AIDS Bureau to provide quality management, technical assistance, and coaching to runway HIV/AIDS program providers of all parts. And this is one of our highest level activities, a community of learning. We have other groups as well, including collaborative groups, and we have HIF-Qual regional groups as a way to bring folks together collaboratively to think about issues. But if you're looking for something more one-on-one, we have consultation services available free of charge, available on our website, nationalqualitycenter.org, in addition to a number of activities that you can do passively, such as the Quality Academy. And we encourage you to check out our website, nationalqualitycenter.org, or to email me, Michael@nationalqualitycenter.org, if you have any questions, comments, or concerns. So, getting to the meat of why we're here today, I'd like to turn it over to my colleague, Dolores Dockery. Dolores has worked with us for a number of years at the National Quality Center, and she may be familiar to you as well in terms of the major role she's taken nationally and internationally in helping to drive conversations around HIV services and quality of care. And particularly from the consumer perspective, Dolores has been an invaluable asset to the National Quality Center and to the United States of America in terms of the way that we think about issues related to HIV service delivery and disparities in care. So it's my pleasure to introduce my friend and colleague, Dolores Dockery, who's going to walk us through the agenda and play MC for the rest of today's call. Dolores?
Great. Thank you so very much, Michael, for such just a warm and grateful present introduction. So today, this is great. I am a woman living with HIV. I have been diagnosed since 1994. And so this topic is just so close to my heart. And the opportunity to have this dialogue with everyone on the call is something that I look forward to and totally appreciate. But most of all, I think it is needed. Our health care access issues and the disparities that impact the life of women living with HIV is such a vital discussion at this time. So today we will welcome and we've introduced ourselves. Thank you, everybody, for putting your introductions in the chat. We'll share our stories, and our presenters have brilliant stories to share, and then we will discuss the common barriers and provide a facilitation to the women's health care. We'll talk about HIV self-management, which is so important, and we'll have, depending on the time allowed, a question and answer session. Next slide, please. Our learning objective today is to explain common reasons why African American and Latino women don't stay in HIV care and don't achieve viral suppression, and we'll explore some of that data. Describe ways African Americans and Latino women can get more involved in their health care, and name 2 or 3 ways that women can support each other to achieve optimum health outcome, which is our goal. Next slide, please. So let's begin with our stories from African American and Latina women. Our first story comes from a longtime colleague of mine, Kneeshe Parker. And Kneeshe Parker will share her experience. She is from St. Louis, Missouri. So Kneeshe, would you like to take it away and share your story with our roundtable discussion participants?
Good morning, everyone. How are you all? Thanks, Dolores, for the warm welcome. I've been in the field of HIV since 1997, and I'm a woman living with HIV as well. With that being said, my life for me really evolved in a different manner of me being an adolescent, being diagnosed with HIV. Receiving that diagnosis is for me to basically find out where I really wanted to go for as health care. I did not know much about HIV at that time. And I had the opportunity to be cultivated with several women in St. Louis, Missouri, who basically took me under their wing to assist me with treatment adherence. And being educated as an adolescent was not easy as well, because being an adolescent, you have so many different things that you want to do in your life, and it's new. You're graduating from high school. You want to be that all-around kid to doing things that need to be done for yourself. So for me, meeting a young woman by the name of Jessica Forsythe, who took me under my wings to make sure that HIV care would be at the forefront of my life, to learn and to embrace it and basically accept it. But during that period of time, she allowed me to be me. And it was a struggle for me. It wasn't easy, you know, walking into a clinic setting. You know, you're wondering if everyone knows your status or know the reason why you're coming, and stigma and things of that nature. So I allowed her over a period of time to work with me and just reassure my heart that I had hope and I could continue the hope that I had. During that early time of 1997, I didn't have my mother around with me. She was very ill at that time, and my sister did a great job with trying to work with me, to get educated as much as she could possibly receive from, you know, the medical team that I was working with. But in terms to that, when I got diagnosed on that Friday, I had to wait till that Saturday to actually meet Jessica. And during that time period of that diagnosis, my sister was working, you know, at a gas station. And I remember calling my sister, telling her that I really need you to come to this healthcare facility. I have some news to give you, and can you leave work? And I ended up giving her my diagnosis over the phone at that time, because her supervisor would not let her leave work without telling her the reason why she needed to leave work. And that really was a thorn in my side at that time, because I really needed my sister to be there with me and be right there by my side as I received that diagnosis. And that was a really big issue for me back then, dealing with stigma and her having to divulge my confidentiality at that time and not being allowed the opportunity to go see after a loved one. So going forward in 2017, I am very pleased with the outcomes of a lot of people that have worked in my behalf over the last 19 years. We do have a keynote speaker that will be presenting today. Jannis Evans is one of my inspirations. Diane Bates, Dana Williams, and a few other women who helped me along the way to allow me to be the flower that I am today, and to be able to empower other women, because stigma is still at the forefront for African American women to receive the care that they need. Even for them to go into a setting just to get a test, they're very scared. And the stigma is so high in several communities that it prevents them from getting the quality of care that they need.
Great. You know, Kneeshe, in terms of thinking about your story, you know, I'm sorry, Dolores, I think you were going to ask some questions. I jumped right back in, like, and it's supposed to be.
That's okay. Go right ahead, and I'll follow up on you.
Okay, great. You know, in terms of hearing your story and, like, a little bit about how self-management from some key women in your life really helped you to understand what HIV was and how to care for yourself and how you fit into a bigger picture, do you think that's one of the reasons why you became involved yourself at Washington University of St. Louis in Project ARC? And, you know, how is that tied together for you?
The impact of me working with WashU, Project ARC in St. Louis, yes, was cultivated by so many different key players. And I think if I did not have those key individuals who supported me in my walk, in my anger, in my frustration, in my emotional drive that I had, which some days was never the same. You know, your mental capacity is very sensitive, and for a person to be so emotionally driven with a diagnosis, sad one day, happy one day, just about a person living with HIV, I think it played an intricate part for me to know that I could live, I can get through this, and that medications were readily and available for me to have. And they showed me how the barriers for the Ryan White system worked at that time. And then them actually taking, you know, the lead to get me into support groups was very helpful for me. And I think with the help that they provided me over the period of time, I know that I have been able to be an empowerment piece for several women and men in my community over a period of time, to just allow them to know that hope is still there, and to meet them really where they are, because everybody's at a different space and time with the diagnosis. So it's not going to happen when we want it to happen. It's going to happen when they need it to happen and when that light bulb moment happens. You just have to be right there to catch them, to support them in every decision. And some decisions may not be the right decision, but they need us to encourage them 100% of the time. And the peer component is very valuable in our city, because I think without the peer support and our health coaches that we have around the table, I think that a majority of our clients would be lost, because they are looking for their personal testimonials to say that I can live, and how did you do it? How did you get this far? And what made you move forward to take charge of your, you know, your life outside of a diagnosis?
I think what you just mentioned today is so key about the peer component and the value that peer support brings to the healthcare system. And I really want you to tell me a little bit more about how peer support is utilized, or what integral part it plays in the care system where you are, and how does that assist in reducing the issues of disparities?
So the way it's set up in Missouri, most of our clients who have had a diagnosis usually come between our linkage to care with the St. Louis City Health Department, or we may get a referral from a social worker from a hospital who has this individual that had came in really, really sick. And the case manager actually is the lead, and he or she will provide that new enrollment portion for the client. I usually try to accompany the case manager on that initial visit, just to shed a little more light from my personal perspective, being a peer, being a woman living with HIV, because a lot of times that's normal questioning that they would ask the case manager, you know, when they're doing the new enrollment. Are you positive? And the case manager may say no, but I have a young woman or a young man that's living with HIV that can support you in your walk. And usually that opens up the door for more conversation. And that conversation is more relaxed, more accepted, and it reduces the barrier of stigma or judgment during that time period. With that being entailed, I'm able to accompany the client or patient to their first several medical visits to try to talk about the upcoming plans or the next step that the providers would work with that individual on a regular basis with, to actually come up with a plan, a care plan for each individual. And I think the providers that we work with now benefit to having that peer component readily and available for individuals to be serviced, because it allows us to bridge the gap of uncertainty, and it helps with the stigma pieces to reduce them and to ultimately get that person virally suppressed, and to talk about the medications and treatment and why it's important for you to keep each and every medical appointment. So I think that's the benefit of our peer support program here in St. Louis, Missouri. And we've had a lot of different people come and you know, shadow our program. It wasn't easy getting through the doors with the providers to build that value piece that we brought to the table. It had to be massaged over a period of time for acceptance because, you know, with new things, you know, it's kind of awkward when you have new people at the table. So I think they are beneficial to having us around the table, and we have dialogue all the time in the clinic setting.
Excellent. Thank you so much, Kneeshe. So,
You're welcome.
Folks who are on the call, I'm going to encourage you to put your questions in the chat box, and as we proceed, I will try to respond to them, but also I'll be responding to them in the question and answer section. Our next presenter is Dawn Trotter, and Dawn is from New York. Dawn, are you on the line?
Yes, I'm here.
Great, Dawn. Please just tell us a little bit about yourself and share with us your experience.
Okay, thank you, Dolores. My name is Dawn Trotter. I'm from Buffalo, New York, and I was diagnosed.
Oh, I'm sorry about that. Okay, got that taken care of. Go ahead, Dawn.
Okay. Hi, and I was diagnosed in 2007. So when I first got diagnosed, as Kneeshe said, you know, it was a crazy experience for me. The first year and a half or so, it was a rocky road for me, but fortunately I had some social workers at the clinic where I got diagnosed that they kind of kept encouraging me. And then I got hit with another diagnosis of congestive heart failure, which they actually only gave me a year to live. So when I lived past that year, I decided, well, you know what, I'm going to live, and I really want to live, and I need to learn about this other diagnosis, HIV, excuse me, that, you know, the only thing I really actually know about it is that people die, because at that time I knew nothing about HIV. So it made me take the initiative to start getting information. And actually the first training that I went through was through the National Quality Center. It was the training on consumers,
In quality?
And in quality, yes. I'm sorry, my brain got frozen. And when I came back from that training, I was so on fire because I had gotten so much information, and I was so uplifted and ready to go, and I was so in a state of I can live, and there's things that I can do to help other people actually feel the same way that I'm feeling. I went back to my clinic, and I went back as a volunteer, and I joined our board. Then, you know, I wanted to do so much, and so one of the things that I brought back was a program that I had learned about panties off of pap smears, it was called. And it was actually to get the women in our clinic to start coming in for their pap smears, and it gave me an opportunity to speak with them one-on-one as another HIV-positive woman and build a rapport with them. And actually, you know, over a year I did data analysis to see how many of the women were actually coming back because they had, you know, been involved with me in this program. And we did have some women who actually said, you know, they wouldn't have probably came back if it wasn't for that. And I built a rapport with them. And after that, I actually got another job at another clinic where I'm at now, Evergreen. And I am a part of the RAP. RAP is the Retention Adherence Program, where I'm actually the peer who, as our clients come in either newly diagnosed or, say, for instance, they may have been diagnosed for a long time and they're just having issues with barriers in taking their medication. I'm there for support to give them my experience. And as Kneeshe said, to answer some of the questions that the doctors can't answer because they're not in that same position they are. And you know, I get those questions, you know, well, when did you start taking your medication? And how are you able to continue to do this? And, you know, what gives you the oomph to continue going and to share your status with people? And, you know, my answer to them is because I want everybody to live. I want everyone to have the same information that I have. And I hope that, you know, eventually if people see me willing to place my face and myself out there and try to fight some of the stigma that's there, because I tell people all the time, you know, some of the biggest stigmas that we place on ourselves is by ourselves. And so I figure maybe if I can be that person to put a face to HIV, that it'll help somebody else do it, and they'll want to become active in their own care to take care of their health and just be as healthy as they can be.
Thank you very much, Dawn. And I'm glad you addressed the issue of stigma. And I want to know where you are. How do you think that the work you're doing is helping to address stigma issues and also helping you reduce some of the disparities among women that you serve?
Well, I think especially in my culture that, stigma is a huge thing. Like when I got diagnosed, in our culture, we don't talk about it. It's not something that should happen to what you would say I was, a heterosexual woman. So, the stigma part of it, I think the way that I'm helping and being able to and help other women to take on the stigma is that they look at me as, oh, she's a strong woman who is willing to say that she's positive, and I see that she is living and she's healthy and she's able to work and live through this diagnosis and take care of her children and have a life outside of work. And, I've gotten married to someone who is negative, and, so they look at me and say, it's possible to still have a life. So I think that's how I'm helping it, and I'm there to answer those questions that maybe they won't ask their doctors, or they won't ask a family or a friend. Sometimes, you just don't want to ask family because you're scared of the stigma of them even knowing that you're positive, and hopefully with them talking to me, they're able to come out to their family and they have the support that they need until they can get that support from their family.
Thank you so very much. Thank you. And remember, participants, put your questions in the chat box. Next presenter.
Yes, next we have Jannis Evans. Jannis is a graduate of Washington University in St. Louis, majoring in urban and regional studies. She began a career in health quite by accident, she says. She volunteered with an aid service agency as a favor to a friend, and the rest is history, a history that spans 25 years. She's worked as a case manager and outreach testing coordinator, a health program coordinator in the Missouri Office of Minority Health, and a health educator in the Bureau of HIV, STD, and Hepatitis. Recently retired from the state, she had not retired from the work, however. Jannis now contracts with the HIV Regional Resource Network of Region 7 for the Federal Department of Health and Human Services, the University of Missouri of Kansas City, and several other community-based organizations throughout the state. Her targeted populations include women of color, older adults, and faith-based organizations. She's the mother of the Amazing Women and granny girl to Gavin the Magnificent. And it's my pleasure to introduce Jannis Evans as our next speaker.
Hi, everybody.
Hi.
Hi.
So, Ms. Dolores, did you have a good question for me, or do I just start rattling?
I want you to tell us about yourself and your experience and the work you do where you are.
Okay, so I'm also in Missouri. I'm here with Kneeshe, and I started off. I had done a lot of theater work in like the 80s, like working with Catherine Dunham Dance Company and that type of thing. And so a friend of mine had come up. She was working with an aid service organization, and she came up with a program to do education. And the education piece that we did, and it was even back in the 90s, was called Danger, Danger, Women at Risk. It was a 3-woman show. And I'd had experiences being a stage manager, and one day one of the women couldn't perform, and I was there on the spot, and I got to do this show, and we started this traveling thing. So the reason I had gotten into the field, a lot of my friends, especially in the dance world and in the theater world, were dying. And we had absolutely no idea why these guys were dying. We'd see healthy men just turn into shadows of their former selves. And I did a lot of care and providing care for these folks because At that time, it's not like it is now. The people were shunned. They were treated so badly. There were not the medications. None of that stuff existed. So this was at the very, head of the epidemic. And I think the thing that struck me the most at that time was how people treated people who said they were HIV positive. It infuriated me. It absolutely infuriated me to go visit my friends in hospitals and nurses and doctors dressed up in hazmat suits and pushing food to people on plastic plates and stuff. It still upsets me a lot. So my personal plea or pledge to myself was that whenever I saw that kind of behavior, I was going to interrupt it, and that nobody would ever be treated badly around me, ever. And I kind of took that and got the job as a case manager as a result of working and doing the volunteer work at that agency at St. Louis Effort for AIDS. And then the next progression was to be counseling and testing, which was one-on-one, which I loved, in prevention. And then advancing to the state in minority health, doing their programming. The emergency response to HIV and AIDS in the African American community was a program that I was over. And then the last part of my appointment with the state was with the Bureau of HIV, STD, and Hepatitis. And in that position, I kind of sought to find programming. What could I bring women into? What could I bring people into that would really be good or something that they could use or an outlet? I just have a place in my heart as an African-American woman for other African-American women and for women of color, because we have so much stuff. You know, that song about, dragging around baggage. We have a lot of baggage, and we have a lot of things that we have to deal with. And then to be able to deal with that and still have that HIV diagnosis, I admire my sheroes, my Kneeshes, and other women who are living with this disease and are able to function and, just shine. And I guess that's what I want to do. I want you to shine, because I hate mean people. I think mean people suck. And I think that mean people who judge other people, why are you doing that? So I have learned how to kind of corral that a little bit and to kind of go through channels, but kind of working on it from the inside out. Making sure that policies are the right policy, making sure that the policy is inclusive, making sure that people that you're making policies for are there at the table and not part of the meal. People have to be involved, and I seek to do that. So coming up with different programming that involves African-American women or women of color or women, period, is really a goal of mine, and working with churches and, trying to knock stigma down. I guess I'm the anti-stigma girl. I'm also working with older adults. Now that I'm an older adult, just seeing just where that population can go, as well as, being old is not the same as being old before. I think a fabulous old thing, So people are still out there. They're still doing stuff. People are still living. So might as well be safe while you're doing that too. So that's kind of my story. Coming up with different ideas and different programming, I was really allowed to do that. I came up with this book club idea, and it was just such a natural thing. These women, you can get out the house, you can come and hang out with a bunch of other women, you can have a safe place to do that and talk and laugh and discuss books and eat food, and that's kind of what it has evolved into. And I was fortunate enough to be able to put that in play in Kansas City and St. Louis with different groups of women, younger women, older women, positive women, negative women, African-American women, white women, any woman that we could find that wanted to come. And if it was a good, safe environment for the people that it was designed for, the whole book club idea, who doesn't like a book club? Oprah has a book club. So, just kind of playing on those kinds of things and coming up with programming that's good for churches that, trying to refine the approach to churches, how to get churches on board. That's kind of been my goal. So that's what I do.
And that is phenomenal because you've touched on several of the topics and several of the solutions that seems to work. You've spoken about the fact that, women need opportunity for social involvement. They need meaningful involvement in advocacy and policies that impact their life, but they also like social involvement with other women who are both positive and negative. The book club idea is great. I myself am a poet, and that's how I am able to express some of the things that have happened in my own life. And so I know the arts a useful outlet. I think when you talk about the impact on getting older and the issues for older women, that is true. And you know that in churches there are more women there than men. So programming in churches that really reaches out to women are excellent solutions. Some of the issues and some of the challenges that women face as they try to access health care and to improve their health. Thank you so much, Jannis. Michael, do we have another speaker?
We do. We have Mrs. Classie McMurray, a native of Batesville, Mississippi. She is the Consumer Community Health Worker of Aaron E. Henry Community Health Center with the Ryan White Program. Through her love for people and her potential to inspire change, she inquired about becoming a consumer community worker after being a member of the Consumer Advisory Board at Aaron E. Henry, and she was later hired in June of 2016. Mrs. Classie is no stranger to the healthcare profession and holds a CNA certification from Manchester Manor of Birmingham, Alabama. Before coming to Aaron Henry in 2016, she worked for many years for a diverse range of organizations, including Southern Care Hospice, Providence Assisted Living, Trinity Mission Healthcare, and Golden Living Nursing Home. Classie's background in the medical profession provides a perfect foundation for community health workers with the Ryan White organization of Aaron Henry. Her duties for Ryan White consist of providing a bridge between providers and HIV consumers that facilitates the medical psychosocial care of the clinic, which is very important. Classie loves to help consumers to accomplish their goal concerning their care and not feel as if they are on this journey alone. Her own personal story living with HIV for over 25 years has and is still inspiring to so many clients. As the new elected Consumer Advisory Board President, she looks after consumer input and guidance from patients regarding the desired delivery of care. Mrs. McMurray Mrs. McMurray's work consists of her working in a team setting as one component of the client-coordinated care. And it's my pleasure to introduce Mrs. Classie McMurray as our final speaker presenter on today's call. And I'm really happy to have you as a Southern woman to share your perspective, Mrs. Classie. Welcome.
Thank you. I am so glad to be here. Hello, everyone. How are you?
Wonderful.
Wonderful. As he stated, yes, I have been on this journey for over 25 years. I never asked the question why, and I would just love to give a little bit of my background of how. I was married to a minister. I am the mother of 2 sons, and so when I relocated, I applied for a job at the hospital and then was just sent off to the health department with no understanding why, no knowledge of anything. And so what pushes me now in this field and in this move is to make sure that consumers never have to face what I faced on that day, dealing with a provider. And so I fight hard now because I want the consumers, they're dealing with enough of being diagnosed, but to have to deal with providers who are not compassionate, and that's what I faced on that day when I walked into that room to just say, you are HIV positive. and to be told, you do understand you're going to die. And so my reaction that day was, no, I will not. I have to live because I have to help somebody else through this. And so that is my fight and my concern now, is to make sure that our consumers know that they are not on this journey, that there is somebody out there fighting for them, and this is not a death sentence for you. To add to my story, I have two sons. My eldest son was diagnosed last January, and 6 weeks later, undetected. I'm in an area to where I reach and I see people, as I heard earlier, in the church. I'm an elder of the church, so I have that opportunity to voice and let people know that there is help. But the one thing we have to get people to understand is you don't have to be ashamed. And you don't have to beat up on yourself fighting, asking the questions why. Now we have to get them to understand, to get past that and seek the help so you can continue on this journey. And so that is my fight, to just be a voice. But even greater yet, to be an example, because it's easy to stand before people and say, I understand what you're going through, and never experienced it. So when you can stand before one who is in need, our Black African women, they can see a living testimony that life is not over, you know, not only in me, but in everyone who has a testimony. They can see that we are here. We are proof that if you seek the help, if you find the strength through other women, and that's one of the things, as women, we tend to want to keep to ourselves, and we don't want to, we're real private. We're very private. But through this, I've come out of that. And so my concern is just to be on this journey to help people come together with women, to let them know that you're not alone, you're going to make it. There are so many things that we have to offer. HIV does not limit who we are, but it really gives us a place to say we can go in places where others cannot reach. So my journey is just to be a fighter, be a voice, do whatever I can to help other women. It does not matter what ethnic background they come from, but just be here to help and be a voice that we all can get through this together and be able to reach so many others that are out there needing our help.
Thank you so much. I want to ask you, Classie, when I think of many of the intersecting issues that impact the lives of women, where you are, can you tell me a little bit more of some of the issues that intersect women's life, that create barriers for them and might even prevent them from accessing health care in a timely manner? What are some of the challenges you're seeing where you are from?
Being from the southern area, small town, everyone knows everyone. One of our major problems is that they don't want to go to where they are because somebody is going to know them, or somebody is going to see them and they're going to ask questions. And so they tend not to want to come and seek the help. One of the other problems that we do have in this area is they're really just in denial. They're in denial that they need help. And by the time that they realize they do need the help, it's too late. And so our biggest problem is learning. I've had a few to tell me, why is there not a Pacific place just for the women to come to and for us together? So that's one of the other problems. They want a place that they can come and they can share. I think that's just a security for them. They don't want to go to the clinic where everybody else is going. The other thing is we have got to build the confidence of the women and the trust that what you come and say to me is going to stay with me. There is a trust issue here in the southern area. It is a very, very big barrier for us. They feel like they can't trust the provider. They feel like they can't trust anybody. So that's one of the barriers that we have.
Okay. Thank you. Some of the intersecting issues that we've explored, and I pretty much I'm asking all the presenters, so chime in. Some of the issues that we face and researchers have talked about that prevents women from, being fully engaged in their health care are issues such as trauma, violence, and then some of the other social issues, such as housing and even, mental health and substance abuse. I want you to talk a little bit about that to create a picture for us of the challenges that women are really dealing with in addition to HIV, because we all know that HIV is not the only issue and that some of these other issues kind of impact how we access help.
Hey, Dolores, this is Kneeshe from St. Louis. Several barriers, mental health and substance abuse play a key factor in engaging with women who live with HIV. They struggle with that over a period of time. And also their life skills. It's a cycle, a genetic cycle that runs through generational curses or generational issues that a young woman was modeled or shown birth to adulthood. And sometimes they don't know how to grasp those barriers, such as budgeting, financial literacy, or even just writing something down as simple as their name. They lack that responsibility because it was never shown to them over a period of time. Those things that were shown to them were very negative in some women. They don't know how to grasp or accept the help that is readily and available for them to have access.
Thank you. Thank you, Kneeshe. Anybody else?
I had done a focus group with a group of women in Kansas City, and so mental health was a big barrier. They said they felt that upon diagnosis they should have had like intense mental health counseling because it was a hard thing to accept. Another thing was that life kind of also intercedes into care. If you have to make a decision, and I think Dawn might have brought that up in the chat room, if you have to make a decision on getting medications and your baby needs glasses, guess what's going to happen? Your baby's going to get glasses. Mm-hmm. That's what's going to happen. That's exactly what's going to happen. If you have to take off work in order for your doctor's appointment or your clinic appointment, if you're not the resident of like brain surgery at a hospital, if you have a regular job, is your job going to allow you to keep taking off for different appointments? And if you do take off for appointments, are they going to start asking questions? Those kinds of things interfere, I think, a lot of times with getting care. And if you're working and if you're not eligible for Ryan White services, that kind of also kicks you kind of like out of the loop a little bit because you're not involved in those group emails or texts or information about care that you may get if you're working within the Ryan White system.
Excellent. Any other challenges any of the other presenters want to talk about? Because what I want to do next is to talk about some of the solutions, some of the interventions, and some of the resources that you would like to share on this roundtable discussion.
Hi, Dolores. This is Dawn.
Hi, Dawn. Yes.
Hi. I wanted to say, one of the barriers I had placed in the chat was, you know, sometimes us as women, you know, we're so afraid that someone, you know, if we aren't at the point where we're sharing our status, or if we haven't even shared our status, you know, we have to balance out or weigh out what's more important in our life. And if we are afraid that maybe possibly, you know, we haven't shared our status and we come across someone who we dealt with in the past and they find out our status and, you know, we're scared of maybe possibly retaliation, even though we may not have even been dealing with this person during the time that we had become diagnosed. We just don't want to take a chance at it. And like I said, you know, putting up against whether, you know, you go to work or do you go to your doctor's appointment, do you take the chance of, because you need a support system, do you tell your family or your best friend because you need that support, or do you worry about if they're going to automatically stigmatize you and now you have no support at all? So, you know, what I try to do is if I see that our patients or our clients have those sort of barriers, I try to meet them where they are. So if they need me to come to their house to fill out some paperwork, or, you know, if we could get them a doctor note that just says it's just from their primary doctor that they need to come and it's not from, you know, the clinic. And then sometimes the hard issue, too, is where the clinic is. If the clinic is known for HIV care, whether it has other stuff, a person isn't going to want that documentation going to, like Jannis said, their job or, you know, anywhere, because, you know, to some people that clinic says HIV and that's all they know. So just trying to meet a client where they are and try to help get in some of the barriers so that they don't have so much against them, so that they can do all the things that they have to do, be a mother, go to work, provide food, but also take care of their health care. So, you know, that's what we try to do. But, of course, we can't help everyone. But, you know, it's just, you know, you try to do as much as you can and link them with other people that maybe if you can't get all of the barriers out the way, maybe someone else can assist them.
Thank you so much. That is so true. And I want to hear more about, and from anybody who is on the call, some of the resources or some of the interventions that you've used where you are and that you want to share with us, because the goal is, one, to identify what are the challenges and the barriers, but also what are the resources available that we can share, and what are some of the interventions that are being used that show some success. So, you know, you can put it in the chat box, or you can just come on the line and share with us.
I hope you don't mind that I'm taking notes as we're talking. I wanted to make sure that the great conversation that we're having is captured at least somewhat. I know that, you know, the chat transcript is going to have additional notes that we'll marry all these notes together when we write to everyone to follow up after today's call. But for me, one of the things that I thought was really cool, and I'm not a woman, so I probably should not be sharing this much and leave the floor for you all, but I love the idea of women's branded services, y'all, like Susan B. Coleman. What a great idea.
Yeah. I mean, it's the more people, I think if you not necessarily share, but the more social interaction, the more you talk about stuff with people who are going through that same experience sometimes is great. And whether it be cancer, maybe whether it be HIV, whether it be any illness, if you can find that kind of support or support group, or it doesn't have to be even a formal group. It can be just, you know, you and your friends. My push is for education. And I know it sounds contrite, but know enough about the system that you're involved in so that you don't have to be wondering who to talk to about this or who to talk to about that. Join the planning councils. I'm one of these controlling people who I want to know why this is like this, so I'm going to join something. I'm going to see. There are national organizations you know, that are doing wonderful work with women and allow women to have platforms. Sister Love with you know, with Dazon. and all of these other organizations. There may be something in your area. Just get involved. Like I said, get your support for mental health. Learn how to advocate for yourself. As long as you know the system, get involved and participate. And you know, nobody can mess with you when you're armed with that. Nobody can mess with you when you know what you're saying.
I totally agree. Totally agree. We have, well, it's almost the end of our session, but I did want to just leave a little space for some questions and answers. I see comments in the chat box, but if anybody has any specific questions that they'd like to pose at this time, please just come on the line and add your question. No questions? Michael?
Okay, here's one that I see that came in the chat room. Living with HIV in silence is a major issue. How do I disclose? How do I live newly diagnosed? How do I find people who can support me in that first year when it's especially sensitive for me? And how do I encourage people who have found this help to then be inspired to help others? Great question.
Great question. Anybody want to provide a response? As I said, I've been HIV positive for 23 years, and it took a long time. It's evolution, stages, and for anybody who is newly diagnosed, I would say that you do not have to put a sign on your chest. But what you do need to do is to reach out to people who you trust and who support you. Kneeshe talked about meeting one woman who was there for her. Sometimes it only takes that one person to initially, help to provide support. For myself, there was a women's organization that had a women's program, and it was a 6 weeks program that allowed me to learn about HIV and to learn about how it manifested in my body. And I'm like I think it was Cassie who talked about education. I was one of those geeky kind of person that the more educated I became the more I was able to build my confidence. I found it for me to tell a few relatives who I knew cared for me and wanted the best for me, and to sit down and to tell them what I was going through, because support is vital. Not all of us have family support, but there is always somebody in our network who will support us. So look to family, look to providers, look to other women who are HIV positive to provide that support that you will need in that first year as you come to terms with the disease that you're now living with.
Another comment came in the chat room for us to help promote Sisters Organizing to Survive, SOS. This is part of the Greater Than AIDS campaign, and it's active in South Florida. I saw links for both Fort Lauderdale and Miami, in addition to some other links. And I'm not sure if anyone who's familiar with SOS wants to provide a little bit more information on this, because it seems like a great opportunity to bring together some of these ideas that we were talking about across our presenters today. Has anyone worked with Sisters Organizing to Survive?
Good afternoon, everyone. How are you?
Good. How are you, Gina?
Good afternoon.
Gina, how are you guys?
Good.
Hold on 1 second. Hold on. Trying to close my door. I'm sorry. Okay. I work over at University of Miami in Miami, Florida. I'm a patient advocate / peer educator. I have been HIV positive since 1999. And my role right now is to link to care newly diagnosed patients. It's also to help families. Right now, I'm working with perinatal infected children, young people from birth to 24, and I come from a background of outreach. So I was at a different department doing outreach. So what I've been in the field since 2005, so I'm also HIV positive. So what I find a lot of in Miami-Dade, a lot like what everyone else has been saying, we just have to love, we have to hug. Compassion is a big issue for me because I'm also a patient as well. So when the patients complain to me, I complain to who I need to complain to. I'm a patient as well. So I just try to have a voice for the patients. I try to teach them how to have a voice for themselves. And I remember people helping me, so that made it easier for me to help someone because I remember what people have done for me, walking me through the process. It's an everyday process. Living with HIV, it is an everyday process. But again, it's still stigma. You know, support groups, you probably get 5 people. It's that problem everywhere, and we try to be private about it. I go to a support group, we don't even say anything about HIV. We just have a plus sign, and it says friends in back of it. You know what I'm saying? So, cool. But it's very hard to get people motivated about HIV and living. So I have a saying, I say HIV live with me, I don't live with it. So it need to come on and run with me because I'm not going to let it stop me. And I try to encourage the patients every day and anybody that I meet every day to live. And I think that's what we got to do as a you know, concerned people.
Thank you so much, Gina. That is true. And so powerful. It is a day-by-day journey. Thank you. Anybody else before we close? I want to thank you all for just sharing your story. We feel that if we tell our story, it would really encourage and help others. I truly believe that. But I know that telling is not always easy, that it is difficult. And like Kneeshe said, we have to meet people where they are and recognize that it's a day-by-day work that we do. But our ultimate goal, and the science tells us, that we can get to viral suppression and we can live long, healthy lives and be productive and raise our children. And what we need to do as women is to help other women to understand that, to take the steps they need to improve their health. So I want to thank you all for sharing. I know it's not always easy, but thank you all. This discussion was very, very, very encouraging and helpful. Michael?
Absolutely. Thank you so much, Dolores, and thanks to all of you for participating in today's call. Laura said it right on the head. We wouldn't have a program without you and without all of your wonderful experience and background that you shared. So thank you so much to all of our presenters, especially, and to all of you who took the time to join us today. You'll receive an email by the end of the day today that has the recording of today's webinar in addition to the notes that we took in the whiteboard and also in our chat room today. So be on the lookout for that. Thanks so much, everyone, and have a wonderful day, and we hope to see you again very soon.
Thank you.
Thank you.
All right.
Thanks, Michael. Thank you. Have a great day. Bye-bye.
Have a great day, everybody. Cheers.
Bye-bye.